Vitamin D is absolutely critical for your overall health, and as it turns out, many of us are deficient in vitamin D. And then when we go to try to increase our vitamin D levels, we do it wrong. So that's why in this video, we're gonna talk about the very common vitamin D mistakes that most of us make. But before we get started, I'm Dr. Zyrowski, and if you wanna take control of your health and do it naturally, go ahead and join my private natural health community called Health Club. In Health Club, we talk about anti-aging, longevity, how to take control of your cholesterol, lose weight, or even detox your body at a cellular level. These are all conversations that are critically important for you to age well and, of course, not fall into the trap that so many of us do where you're getting all these different health conditions and suffering from chronic disease like most people. So I'll put a link in the description below so that you can join Health Club and take control of your health and do it naturally today. So let's go ahead now and talk about this vitamin D mistake that most of us make. Well, the first one is going to be this, and is taking your vitamin D without a fat. See, vitamin D is a fat-soluble vitamin. So basically, we absorb it best if we consume it with a fat. A fat like coconut oil or olive oil, or even eating a fatty food. So if you kind of think of a scenario here that could work, well, if you're eating a salad, maybe you have a dressing that has olive oil in it that will help you absorb your vitamin D better. Or maybe you're having a snack. Well, you could have some macadamia nuts, which are high in fats, and then you take your vitamin D with that. So you get the point, and really you have to just make sure that you're taking your vitamin D with a fat to get the most out of it. The other big mistake here is that we are taking vitamin D, but we lack the proper cofactors in order to get the most out of it. Well, what do I mean here? So basically, you have different minerals and vitamins in your body that help you absorb vitamin D. So for vitamin D, you're going to have cofactors that are necessary, like magnesium. And this is a big problem because it's estimated in the United States that 50% of you are actually deficient in magnesium. But there's other cofactors involved too. You're going to need cofactors like zinc and vitamin A. So here's what I typically would recommend to somebody. Instead of trying to chase down all these different vitamins in order to get the most out of your vitamin D, what I would say is take a good multivitamin. And I'm not talking about the typical junk multivitamins that are out there in the store that have a little dusting of everything but really do no good for you. I'm talking about a good quality multivitamin that will give you all the cofactors necessary in order to get your vitamin D absorbed well. Now let's talk about another cofactor, and that's vitamin K2, okay? I'm going to talk about this one specifically because vitamin K2 is very important to take with your vitamin D3. Now, if you're not taking vitamin K2, what happens? Well, you increase calcium levels in the body, and that calcium starts to become misplaced. Instead of that calcium going into your bone and helping you build stronger bones and joints, essentially it can start to go into the soft tissue. It can go into your arteries. And so that K2 keeps the calcium out of the soft tissue and arteries in the bone where you want it. So many people ask me, well, how much K2 do you actually need in as far as ratio goes with your vitamin D? Here's the thing, is a good quality vitamin D that has K2 in it, they will figure that out. The scientists behind the scenes will figure out how much you need. And what I'll do is I'll put a link to the vitamin D3 K2 combo that I personally use in the description below. It has vitamin K2, MK7 in it. And once again, it's all figured out for you so you don't have to overthink this. Now let's move on to the next thing, and that is a one-size-fits-all approach. Whenever taking your vitamin D, one size never fits all. Here's a couple factors you want to think about. First of all, what kind of climate do you live in? If you're unable to get at least 30 minutes of sunshine on your skin a day, and you want to think sunshine in a bathing suit type of situation, so if you can't get that 30 minutes of sunshine every day, you will become deficient. So the climate that you live in makes a big difference. If you live in an area where you're getting that sunshine every day versus an area where I live in where there's lots of overcast and very cold, cloudy weather, you know what? You're going to have two completely different scenarios. So you're going to want to take vitamin D according to that situation. The other thing to think about is, well, what is your current state of health? For instance, if you have a gut health issue, you have inflammation in your gut, you have some sort of Crohn's, colitis, IBS, some sort of problem going on there with your digestion, then essentially you will not absorb your vitamin D as well even if you're doing all the different steps that we already talked about. So therefore, you always want to get to the root cause of your problem, solve your gut issue so that, of course, you're absorbing your vitamin D well. Next is, are you on a medication? Because many of the very common medications that are utilized today will strip you of your vitamin D stores. So that means that you're taking vitamin D and you're losing a lot of it as well. So what we have to consider is your current state of health. Well, what could you really do in order to determine where you fall? A vitamin D blood test would be a great way to go and figure out where you fall and then, of course, where to go from there. So just remember, one size doesn't fit all. Now let's talk about the next big mistake, and that is taking too much, right? We hear you're going to take too much vitamin D, you're going to overdose, you're going to become toxic because it's a fat-soluble vitamin. I will tell you, in all my years of taking care of patients, I have never seen somebody take too much vitamin D. It's very rare because it is kind of hard to do. The big issue that we face today is everybody is so afraid to take vitamin D that they don't take nearly enough. And so when you're not getting enough vitamin D, you find yourself in a situation where your immune system isn't functioning as well. You have way more inflammation in your body. You're going to find that your bones are starting to become weak. Your body really struggles without the proper amounts of vitamin D. Most people don't have enough. And so what you're going to find is that taking somewhere between 5 to 10,000 IUs is really going to be the ideal scenario for you to get plenty of vitamin D every day. And when you look at many of the different big organizations out there, they're going to range anywhere from 500 IUs to, the Center for Responsible Nutrition saying 10,000 IUs. And so you're going to see this big, broad spectrum of how much vitamin D you should take. Now, the other thing to consider here is that because so many people are deficient in vitamin D, they'll go to their doctor and they'll give them, 50,000 IUs for a month or 50,000 IUs for the course of a week. They'll give them a really high dose for a short period of time. In order to get the best therapeutic benefits from vitamin D, you want to be taking the proper dosing daily. Like I said, that typically falls anywhere from 5 to 10,000 IUs per day. So there's a far greater chance you have a deficiency than you having too much vitamin D in your body. And if it's ever in question, always just go and take a vitamin D test and see where you stand. I'll put links in the description below to all the resources, including the vitamin D that I personally use. It was a pleasure seeing you in this video. I look forward to seeing you in this video next.